It's a pleasure to be with you. The title of this session is Organization and Financing of Public Health Part 3, DHHS and the CDC. There are no disclosures for this presentation. Objectives include review the federal government's public health powers and activities, review the organizational structure of the Department of Health and Human Services, DHHS, describe the difference between mandated and discretionary DHHS spending, review the history of the Centers for Disease Control and Prevention, CDC, review the key functions and activities of CDC, review the 3 CDC centers that address communicable diseases, review the Immunization Services Division. Let's now consider the federal public health system for a few minutes. Despite constitutional restrictions on the federal government's role in public health, it still plays a significant role in public health through the application of 2 constitutional powers delegated to the federal government that relate to public health: the power to tax and spend for the welfare of the nation, and the power to regulate interstate commerce. The federal government's activities can generally be categorized as falling under one or more of the following areas. 1. Allocation and distribution of resources to public health actors. 2. Information generation and distribution. 3. Healthcare access assurance. And 4. Regulation and enforcement. Most federal government public health activities are based on its power to tax and spend. The power to tax can be used to encourage or discourage certain behaviors. For example, the federal government may encourage private business to provide health insurance to employees through tax credits. It may discourage the consumption of tobacco products or alcohol through the imposition of excise or sin taxes. Spending may be either the funding of projects and programs carried out by the government itself, financing contracts with external parties, or providing funds through grants. For example, the federal government conducts and funds health monitoring, surveillance, epidemiological studies, health and biomedical research. It surveys the nation's health status and health needs. It develops policies, guidelines, and standards for public health practice. It provides direct and indirect funding to state and local public health agencies, as well as private organizations. It conducts and supports public information, education, and research on health-related matters. It provides education and training for the public health workforce, and it funds or provides access to personal health services through such programs as the Indian Health Service, community health centers, Medicaid, Medicare, State Children's Health Insurance Program, SCHIP, and Veterans Health Care. The federal government's health-related regulatory authority is generally derived from the Commerce Clause, the constitutional provision permitting the federal government to regulate interstate commerce. Although more limited than the authority to tax and spend, the federal government does impose and enforce regulations and laws in several public health areas. For example, federal agencies enforce regulations concerning food, drugs, occupational safety, and protection of the environment. The federal government can also monitor, regulate, and control certain communicable diseases that affect commerce. The central federal agency responsible for public health and healthcare in the United States is the Department of Health and Human Services, DHHS. Its mission is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. Through 12 operating divisions, the DHHS administers more than 100 health-related programs in a wide range of areas, including health and biomedical research, epidemiology and surveillance, disease prevention and immunization, food and drug safety, providing access to primary health care for certain populations, and bioterrorism response preparedness. These programs protect the health of all Americans and provide essential human services, especially for those who are least able to help themselves. In 2022, the DHHS directly employed approximately 84,000 people and had a budget of $1.7 trillion in outlays. About 80% of the budget is mandatory funding of the Medicaid and Medicare programs meant to improve care, drive quality, promote the well-being of the whole family, and focus on prevention. Discretionary programs account for 10% of the budget and includes funding for public health, research and development, substance abuse overdose prevention, mental health, maternal health, cancer prevention, HIV programs, and equity for disparate populations. There are 12 divisions in the Department of Health and Human Services, DHHS. 9 of these divisions are components of the U.S. Public Health Service. The other 3 operating divisions of DHHS are designated human service agencies and include the Centers for Medicare and Medicaid Services, Administration for Children and Families, and the Administration for Community Living. The 9 operating DHHS divisions designated as part of the Public Health Service include the National Institutes of Health, NIH, Food and Drug Administration, FDA, Centers for Disease Control and Prevention, CDC, Health Resources and Services Administration, HRSA or HRSA, Agency for Toxic Substances and Disease Registries, ATSDR, Indian Health Service, IHS, Agency for Healthcare Research and Quality, AHRQ, Substance Abuse and Mental Health Services Administration, SAMHSA, and the Administration for Strategic Preparedness and Response, ASPR. The U.S. Public Health Service also includes 2 staff offices within the Office of the DHHS Secretary, the Office of Global Affairs, OGA, and the Office of the Assistant Secretary for Health, ASH. These operating divisions and staff offices themselves each contain many sub-agencies and offices, administering hundreds of programs within the DHHS. As you can see, the scope of activities and services undertaken by the DHHS is vast. Our discussion of DHHS operating divisions begins with the Centers for Disease Control and Prevention, CDC, the preeminent public health organization in the United States and the world. On July 1st, 1946, the Communicable Disease Center opened its doors and occupied 1 floor of a small building in Atlanta. Its primary mission was simple, yet highly challenging: prevent malaria from spreading across the nation. armed with a budget of only $10 million and fewer than 400 employees. The agency's early challenges included obtaining enough trucks, sprayers, and shovels necessary to wage war on mosquitoes. As the organization took root deep in the South, once known as the heart of the malaria zone, CDC founder Dr. Joseph Mountain continued to advocate for public health issues and to push for CDC to extend its responsibilities to other communicable diseases. He was a visionary public health leader with high hopes for this small and, at the time, relatively insignificant branch of the public health service. In 1947, CDC made a token payment of $10 to Emory University for 15 acres of land on Clifton Road in Atlanta that now serves as CDC headquarters. The new institution expanded its focus to include all communicable diseases and to provide practical help to state health departments when requested. The Centers for Disease Control and Prevention, CDC, is the foremost epidemiological, surveillance, and disease prevention agency in the federal government. CDC's key functions include monitor and report on the nation's health, detect health problems and disease outbreaks, research and implement disease prevention strategies, develop and advocate sound public health policies, promote health behaviors, and provide public health leadership and training. The CDC is the nation's go-to agency for public health and is the voice of public health for the nation. The CDC houses some of the best epidemiologists, biomedical, behavioral, and social scientists, prevention researchers, health policy analysts, and health economists in the world. Many know the CDC for its outstanding work related to infectious diseases. Its staff travels to sites worldwide when infectious disease outbreaks occur. The CDC has also been a leader in bioterrorism, threats, research, and practice. The CDC is actively involved in non-infectious disease prevention, including the control of chronic diseases and injuries. The CDC publishes the Essential Morbidity and Mortality Weekly Report, MMWR, which contains the latest information on reportable diseases, new hazards, and other emerging health conditions. The CDC is considered the nation's premier and largest public health organization. In 2023, Dr. Rochelle Walensky, the CDC director, stated, "At CDC and throughout public health, we are in a pivotal moment for data and surveillance, one marked by opportunities, challenges, and the need for change." Dr. Walensky's statement underlined that data improvement and analytics have become an important focus for the CDC. The Public Health Data Modernization Initiative, DMI, is at the heart of a national effort to improve the data that can improve health. This cross-cutting strategy will move us from tracking threats to anticipating them. DMI is a multi-year, multi-billion-dollar effort to modernize data across the federal and state public health landscape. The initiative focuses on accelerating health-related data modernization capabilities across private and public entities, improving the skills of the public health workforce in data science and informatics, and innovating in areas of modeling, predictive analysis, artificial intelligence, and machine learning approaches to improving health. The CDC stated that DMI will help our nation move from siloed public health data systems to connected, resilient, adaptable, and sustainable response-ready systems that can help us solve problems before they happen and reduce the harm caused by the problems that do happen. In 2021, under the Coronavirus Aid, Relief, and Economic Securities CARES Act, additional funds were provided for data surveillance and analytical infrastructure to leverage data for surveillance, detection, and situational awareness to allow localized, targeted responses and decision making using more real-time data to respond to outbreaks like COVID-19. Expand electronic exchange and integration of data between health stakeholders, including electronic health records, which is essential for timely, accurate, and accessible disease surveillance, and support public health science, informatics, and information technology workforce. The CDC has 3 centers to prevent, detect, and control communicable diseases. The National Center for Immunization and Respiratory Diseases, NCIRD, National Center for Emerging and Zoonotic Infectious Diseases, NCEZD, and National Center for HIV/AIDS, Viral Hepatitis, Sexually Transmitted Infection, and Tuberculosis Prevention, NCHHSTP. The mission of the National Center for Immunization and Respiratory Diseases, NCIRD, is the prevention of disease, disability, and death through immunization and by control of respiratory and related diseases. The NCIRD accomplishes its mission through the work of 5 divisions: bacterial diseases, influenza, viral diseases, immunization services, and coronavirus and other respiratory diseases. Let's spend a few minutes discussing common respiratory infections. The most common respiratory infections include bronchitis, the common cold, croup, influenza, COVID-19, and pneumonia. Bronchitis symptoms include chronic cough, occasional yellow-gray phlegm, breathlessness, fever, malaise, sore throat, and chronic wheezing. The disease results from inflammation of the bronchi. Bronchitis is caused by several viruses, including influenza, respiratory syncytial virus, RSV, adenovirus, rhinovirus, and coronavirus. Bronchitis can be caused by bacteria, including Bordetella pertussis, that causes whooping cough in children, mycoplasma, and chlamydia. Bronchitis symptoms can also be caused by substances that irritate the lungs, such as tobacco smoke, dust, fumes, vapors, and air pollution. Immunizations for influenza, RSV, COVID-19, and pertussis cover several organisms that cause bronchitis. The common cold causes upper respiratory symptoms and is commonly caused by rhinovirus, but can also be caused by coronavirus, RSV, and parainfluenza. RSV and COVID-19 immunizations will cover some organisms that cause the common cold. Croup is an upper respiratory infection associated with inspiratory stridor, commonly caused by parainfluenza and influenza viruses. Croup-like symptoms can also be caused by bacteria, like Haemophilus influenza B, HIB, and diphtheria. Influenza, HIB, and diphtheria immunizations will cover several organisms that cause croup. Influenza is a viral respiratory infection that causes upper and lower respiratory symptoms. The CDC estimates that influenza caused 9 million to 41 million illnesses, 140,000 to 710,000 hospitalizations, and 12,000 to 52,000 deaths annually between 2010 and 2020. Influenza vaccination reduces the risk of flu illness by between 40 and 60% among the overall population during seasons when most circulating flu viruses are well matched to those used to make the flu vaccines. In general, current flu vaccines tend to work better against influenza B and influenza A H1N1 viruses and offer less protection against influenza A H3N2 viruses. COVID-19 causes systemic upper and lower respiratory symptoms and long COVID. The etiology is a coronavirus called COVID-19 or SARS-CoV-2. It regularly evolves into new variants. As of October 2023 globally, there have been 771 million confirmed cases of COVID-19, including 6.9 million deaths, reported to the World Health Organization, WHO, and a total of 13 billion COVID vaccine doses administered. Current COVID-19 vaccines provide significant protection against illness and severe disease. Pneumonia is an infection of the lungs. Streptococcus pneumoniae is the most frequent bacterial cause of pneumonia. Other bacteria that cause pneumonia include Haemophilus influenza, Moraxella catarrhalis, Mycoplasma, and chlamydia. Viral causes of pneumonia include influenza, RSV, and COVID-19. Respiratory syncytial virus, RSV, is usually a mild disease, but can occasionally be severe and life-threatening in young infants and the elderly. RSV can present with mild cold-like symptoms, including a stuffy, runny nose, headache, cough, fever, and sore throat. RSV can cause pneumonia associated with difficult breathing, wheezing, and severe cough. Immunizations for strep pneumoniae, HIB, influenza, RSV, and COVID-19 cover many organisms that cause pneumonia. The Immunization Services Division seeks to protect individuals and communities from vaccine-preventable diseases. The division administers the Vaccine for Children program and Section 317 immunization grants to state health departments. It provides technical support for immunization information systems and conducts research and evaluation of programs to improve vaccine uptake and delivery of vaccines. The division provides financial support for immunization programs and providers and public health education about vaccinations. The Vaccine for Children VFC program is a federally funded program that provides vaccines at no cost to children who might not otherwise be vaccinated because of inability to pay. VFC eligible children are those through 18 years old who meet at least one of the following criteria: Medicaid eligible, uninsured, American Indian or Alaska Native as defined by the Indian Health Care Improvement Act, underinsured, which means that a child has health insurance but it doesn't cover vaccines, or doesn't cover certain vaccines, or covers vaccines but has a fixed dollar limit or cap for vaccines. Once that fixed dollar amount is reached, a child is then eligible to receive VFC vaccines. underinsured children are eligible to receive vaccines only at federally qualified healthcare centers, FQHC, or rural health clinics, RHCs. The Immunization Services Division also administers the 317 program that provides discretionary funding to support immunization program operations at the local, state, and national levels. For example, this funding may be used to vaccinate uninsured or underinsured adults 19 years and older, and in limited circumstances, fully insured individuals during public health response situations. Public health has had many accomplishments during the 19th and 20th centuries. In 1999, CDC listed 10 public health achievements that increased the lifespan of Americans during the 20th century by 30 years. 25 of those years were attributed to the work of public health. Those 10 accomplishments are listed on this slide. Vaccinations are considered one of the most effective public health measures ever developed. Vaccinations resulted in the eradication of smallpox, elimination of poliomyelitis in the Americas, and control of measles, rubella, tetanus, diphtheria, Haemophilus influenza type B, and other infectious diseases in the United States and other parts of the world. The importance of vaccinations for public health is why the CDC has an Immunization Services Division of the National Center of Immunization and Respiratory Diseases. When I finished my pediatric residency, we had a limited number of vaccines available to prevent infectious diseases. Since then, the number of vaccines has grown dramatically, as seen listed on this slide, and that list will expand as science technology continues to advance. The National Center for Emerging and Zoonotic Infectious Diseases, NCEZD, works to protect people at home and around the world from emerging and zoonotic infections ranging from A to Z, anthrax to Zika. We are living in an interconnected world where an outbreak of infectious disease is just a plane ride away. The work of the NCEZD encompasses foodborne and waterborne illnesses, infections that spread in hospitals, infections that are resistant to antibiotics, deadly diseases like Ebola and anthrax, illnesses that affect immigrants, migrants, refugees, and travelers, diseases caused by contact with animals, and diseases spread by mosquitoes, ticks, and fleas. The NCEZD conducts extensive disease epidemiology investigations, laboratory programs, and basic and applied research relating to emerging and zoonotic infectious disease, and plans for and coordinates prevention and outbreak response. Recent outbreaks include numerous West and Central African Ebola outbreaks since 1976 to the present, a viral infection with a case fatality rate of approximately 50%. The Zika outbreak from 2015 to 2016 that caused microencephaly in babies born to mothers infected during pregnancy. And the COVID-19 pandemic, 2019 to the present. The fiscal year 2022 budget for the NCEZD was $678 million. Current key initiatives include the advanced molecular detection and response to infectious disease outbreaks which represents new molecular technology like polymerase chain reaction PCR and other rapid antigen tests to quickly and effectively identify infectious organisms. For example, PCR and rapid antigen tests provided important epidemiologic data during the COVID-19 pandemic. This initiative also supports investments in bioinformatics, database development, data warehousing, and analytics. Two NCEZD initiatives facilitate partnerships and a holistic approach to disease prevention. System for Enteric Disease Response, Investigation, and Coordination, CEDRIC, and One Health. CEDRIC is a web-based platform that facilitates multi-state outbreak investigations of foodborne and animal contact diseases. One Health is a collaborative transdisciplinary initiative that links health interests of people, animals, plants, and their shared environment. For example, One Health collaborates on reducing antibiotic resistance by decreasing the inappropriate use of antibiotics in humans and animals. The National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention, NCHHSTP, collaborates with partners at the community, state, and national levels to prevent and control HIV/AIDS, sexually transmitted diseases, STDs, viral hepatitis, and tuberculosis, TB. The center collaborates on research, surveillance, technical assistance, evaluation, and development of prevention programs. The fiscal year 2022 budget was $1.4 billion. The center is particularly interested in engaging young people through advancing school-based health and disease prevention programs, developing data and educational material to support clinicians, and developing communication materials to support disease prevention among highly affected groups. In summary, the federal government impacts public health by taxing and spending and regulating interstate commerce. Most federal government public health activities are based on its power to tax and spend. Discretionary funding, which includes public health funding, accounts for 10% of the DHHS budget. The Data Modernization Initiative will help the nation move from siloed data systems to connected, resilient, adaptable, and sustainable response-ready systems. Vaccinations are considered one of the most effective public health measures ever developed.